My name is Impaso Ripava, and today we are going to discuss more about HIV and AIDS. So today I have blessed with a guest who will give us more insights about HIV and AIDS. So I welcome you in this podcast.
Thank you.
And I beseech you to introduce yourself.
I'm Evans Pierce from Deland.
Okay, let's talk about HIV and AIDS. What does HIV stand for?
Okay, HIV stands for Human Immunodeficiency and Virus. HIV is affect and destroy cells of your immune system, making it hard to fight off other diseases. When HIV has severely weakened your immune system, it can lead to acquire immunodeficiency syndrome called AIDS.
Okay, you have talked about HIV. What about AIDS?
Okay, AIDS is the final and the most serious stage of an HIV infection. People with AIDS have a very low account of certain white blood cells and severely damaged immune system. They may have additional illness that indicate that they have progressed to AIDS. Without the treatment, HIV infections progress to AIDS in about 2 to 10 years.
Okay, so what's the difference between HIV and AIDS?
The difference between HIV and AIDS is that HIV is a virus that weakens your immune system. AIDS is a condition that can happen as a result of an HIV infection when your immune system is severely weakened. You can't get HIV if you are not infected with HIV. Thus, to treatment that slow down the infective of the virus. Not everyone with HIV progresses to AIDS. But without treatment, almost all people living with HIV are in advanced to AIDS.
Okay, so what does HIV do to a person?
HIV infects the white blood cells of your immune system called CD4 cells or helper T cells. It destroys CD4 cells, causing your white blood cells count to drop. This leaves you with an immune system that cannot fight off into infections, even those that could not normally make you sick. HIV initially makes you feel sick with flu-like syndromes. Then it can hide in your body for a long time without causing not an able system. During that the time, it slowly destroy your T cells. When your T cells getting very low, you begin to get a certain illness that people will have immune system. Don't get HIV as a progress to HIV and AIDS.
Okay, what HIV can cause?
AIDS can cause rapid weight loss, extreme tiredness, meaning that you feel continuous tiredness in your bodies. Even once maybe you want to waken somewhere, you feel the tiredness and you overlook any kind of action of your body. So mouth or gentle answers, fever, night sweat, and skin discard. Other illness and cause cancer often happen in people living with AIDS and can cause additional syndromes.
Okay, I have heard about retrovirus. So what is retrovirus?
Okay, retrovirus is a virus that work backwards from the way human cells do. Human cells have instructions, DNA, that send a message to NRA to make building bloods for your body, which called protein.
Okay, can we say HIV is the retrovirus?
Yes, it is that because all virus is in advance your cells and then use your cells machinery to make more copies of themselves. HIV not only itself, but it also insert it instruction into your DNA.
What does HIV affect?
Okay, it's that HIV only affect certain people. Anyone can get HIV if they are exposed to virus. Having sex without a condom or sharing the needles to injection drug are the most common way that HIV spreads.
Okay, so what are the groups of people who always affected by HIV?
Yeah, people who identified as a guy, bisexuality, and men who have sex with a man, MSM. Secondary, certain race such as people who are black and Hispanic. Thirdly, those who are exchanging sex for money or other items are also at a higher risk for HIV infections.
Okay, what are the symptoms of HIV?
Yeah, you can have HIV without having any symptoms. This is why it is important to get tested. Even if you don't feel sick, visa syndrome, we have a fever, chill, fatigue, softened, muscles ashes, night sweat, rash, swollen, lymphocytes, and many more.
Okay, so what are the stages of HIV?
Okay, HIV has 3 stages, so I can explain in detail below. Firstly, acute HIV.
Yes.
Some people get in flu-like syndromes a month or 2 other after they are being infected with HIV. These symptoms often go away within a week to a month. So secondly, we have chronic stage. This is after a acute stage, you can have HIV for many years without feeling sick. It's important to know that you can still spread HIV to others even if you feel well. Thirdly, ends. Thirdly, we have point ends. AIDS is the most serious stage of HIV infection. In this stage, HIV has severely weakened your immune system, and the opportunity infection are much more likely to make you sick. Opportunistic infections are ones that someone with a healthy immune system could typically fight off. When HIV has advanced to ends, this illness take an advantage of your weakened human immune system. You are more likely to get certain cause when you have AIDS. Okay, HIV is caused by human immunodeficiency virus. The virus attacks the helper T cells of your immune system, leaving it weakened. HIV is caused by having too few immune cells to fight off other illness.
Okay, how does HIV spread?
Okay, you can get HIV through blood, semen, vaginal fluids, breast milk, and rectal fluid of an infected person. People of all sex and sexual orientation can get infected with and spread HIV. The virus can enter your blood through your mother or through your mouth.
Yes.
Yeah. So we have animal parts like anus, we have a penis, we have vagina, or broken skin. It can get through your skin unless you have can't. Even once you are a person have a cut,
Yes.
as you got injured, so some bad person can have like a wound, so it get an advantage to getting HIV. So there are people like pregnant people. Pregnant people with HIV can also give it to their babies. Yeah, if women people
Yes.
go to the birth, what is happening usually? Maybe the outlook people.
Yes.
Sometimes it can happen. Women with pregnancy, yeah, getting the born baby while they are in their homes. So most of people, they are danger to get HIV because they are usually they use traditional methods that can get the lead and then get the danger to get an HIV rather than the one who went to the hospital. Yeah, that's why it can help us that.
Yes.
So certain have sex without a condom, and sharing the needles. This is like other ways that can spread the HIV. Taking drug, yeah, are the most common ways that HIV spreads. Even if you feel fine, you can still give HIV to others.
Okay, in your statement, you have talked about mouth. So, can someone get HIV from kissing?
Yeah, exactly. It can happen. What is actually happens? We have you know about laughing partner to kiss an agent, her or he partner. What is happening is like you try like pass. Let's say if we say mouth, mouth very stiff inside teeth, yeah. So once you do like kissing, uh, imagines someone can cause maybe a cut into our lips, of course. So if there is exchanging of blood, through your kissing, definitely someone can get a HIV through mouth.
Okay.
This is what I mean.
Okay. So, how can I know if I have HIV?
Okay. To know that this person can get the HIV is not a simple way, but it depending if a person feeling that today I want to know my status. So he or she can go to the hospital, attend even any clinic, even private clinic, to get a test blood. It's the only way that the person can know that he is positive or negative. And there another way how you can know your blood status through screaming. There's certain instrument whereby hospital given an instrument. You try like a needle into the mouth. Yeah, you move, you piece it into the mouth and rounding on the mouth. Then after some minutes, yeah, you test it, so you know if it is go this side and this side, you know I'm positive or negative through that particular instrument. So there's two stages that a person can know that I'm positive or negative through getting blood once you are attending the hospital. Even if you visit someone who has an instrument that you can test yourself, even your home and your area, as far as I'm concerned.
Okay, how HIV is diagnosed?
Yeah, HIV can be diagnosed with either a test of your blood or your spit, which called is saliva.
Yes.
You can take a test at home in a healthcare provider office or at a location that I provide test is your community. Yeah, that's why we can recognize HIV.
Okay, what tests diagnose HIV?
Okay. There are three types of HIV test. First one, antigen or antibody test. Secondly, we have antibody test. Thirdly, we have nuclear acid test. So I want to explain according to the detail.
Okay.
So antigen testing, it test look for marker on the surface of HIV called P24. Antibody testing look for chemical your body makes when it react to those markers. HIV antigen look for both. A healthcare provider will take a small sample or a blood from your arm with a needle. The blood is sent to a lab and tested for P24 and antibodies to it. An antigen test is usually able to detect HIV in 18 to 45 days after exposure. Secondly, I'm already said there's antibody test.
Yes.
Antibody test, it test look for antibodies to HIV in your body or saliva, which can be done with a blood drop from your arm or a finger with a stick that you can lap or your gum to collect saliva. An antibody test can take 23 to 90 days after exposure to detect HIV. Antibody test done with a blood drop can detect HIV sooner than those done with a saliva or blood from a finger print. Thirdly, as already said, the nucleic acid test. It looks for HIV virus in your blood. A healthcare provider will take a small sample of your blood from your arm with a needle. The blood then it is sent to a lab and tested for HIV. A nut can type detected HIV 10 to 3 days after exposure. Noted that this is a test is not often used unless you have and had a high risk exposure.
Okay, is there a cure for HIV?
Yeah, there is currently no cure for HIV, but there are many treatment options that can slow the progression of the HIV significantly.
How is HIV treated?
HIV is treated with a combination of medicine which is called pills, taken by month every day. This combination of pills is called antiretroviral therapy, ART. Taking a combination of that type of pills rather than just one is the most effective way to keep HIV from multiplying and destroying your cells.
Okay, so what are the medications used to treat HIV?
Yeah, each type of pills used in ART has a different ways of keeping HIV for making more copies of itself or from infection your cells. There can be different brand names of the same type of ART drug. Types of ART drug medication, they are including, we have fusion inhibitors. So we have CCR5 antagonist attaches in inhibitors. Combination of HIV medical. That's it.
Okay, how can I take care of myself while living with HIV?
While living with HIV, it's very important to take your medication as a precaution, and make sure you don't miss appointments, escort treatment, adherence.
That's all?
Yes.
Okay, so how I can reduce my risk of getting HIV?
Yeah, the best way to reduce your risk of HIV to be aware of low age sprays and protect yourself during certain activities. Having sex without a condom, and sharing needles to take a drug are a most common way that HIV spreads.
Okay, can medications prevent HIV?
Yeah, there are medication that can help prevent HIV in people who have been exposed or are at a high risk for exposure. These include pre-exposure and post-exposure. Yeah.
Okay, does HIV go away?
HIV does not go away on its own. It inserts itself into your DNA. So, your cells think that it's a part of you. There can be many years without symptoms after initial infection. But HIV can still be damaging your immune system even if you don't feel sick.
Okay, can a girl get pregnancy if she has HIV?
Some people think that HIV has your chance of getting pregnant, but this is not true. If you have HIV and wanted to become a pregnant, talk to your healthcare provider. Together, you can make a plan before you try to get pregnant to keep you or your partner and any future children healthy.
Okay, when someone should see healthcare providers?
Yeah, call your healthcare providers immediately if you think you have been exposed to HIV. It is important to begin treatment as soon as possible if you do have HIV.
Okay, to reach this part, I was call our discussion for today, and I much appreciate you for giving us more information about HIV and AIDS.